And what interested me in the place to start with was, I think, reading an advertisement in the paper about the Eden philosophy, which was this wonderful idea that the residents have a choice and they should be living in a home-like environment and it should be relaxing and they should be able to, like have home-cooked meals and have a very home-style environment, nothing clinical where you don't wear scrubs, you just wear your clothes so you don't seem like an authority figure. So while we're doing housekeeping services, laundry services, their personal care services and medication services, we're serving food and all not in scrubs and stuff. Like you wash your hands and you take your gloves on, and you put your gloves off and you do all those things and keep clean, but it really is a horrible thing to know that you're being funded for something that sounds like it's 4 jobs, and they're telling the family that all these wonderful services are provided, but what they're actually providing is 1 staff with all these labels and very little time to complete all these tasks, so things get left behind. If you're working the evening shift with me, and upstairs with 30 residents, there are 2 staff. So there are 2 of us and 30 residents. And sometimes the residents are calling for different things. They need a sit-to-stand to go to the washroom. That takes 2 people. So you're taking your partner away from their side of the cottage and their tasks and their residents to help you get 1 person on the toilet. But there are 1, 2, 3, 4, 5 residents who use that sit-to-stand, and when we only have 1. So if 1 person wants to use the toilet at the same time another person wants to use the toilet, someone has to wait. And if someone has to wait too long, they're going to have an accident. And if they have an accident, then we should immediately be doing their laundry because it's soiled and that shouldn't sit in their room, it's unhygienic. Now, if a resident has an accident and we have to do their laundry right away, Points West has told us that we are to make sure that we do the appropriate paperwork so that the families can be charged an extra $10 for the extra load of laundry, which was initially our fault because they had called to go to the washroom, but we couldn't get there in time. Short staffing is always a major, major concern. It was then, it still is now. If somebody would call in sick, they would sometimes just not even try, like, oh, somebody called in sick. So we're paying them for their sick day. We're not also going to pay them for their sick day and somebody else to come and work. So we'll skip baths and we'll skip laundry and we'll skip room cleans because those are the lowest priority on the totem pole. But we definitely can't offer overtime for somebody to come in. As an HCA at Points West, we're giving residents their medications. We don't even know sometimes what the medications are because we don't need to. We're just giving them. You know the name of it, the dose of it, the route it's to go in. Cytotoxic medications are apparently safe for HCAs to give. It was later explained to us as just some kind of very dangerous medication. It can cause serious birth defects if you're pregnant. It could cause all sorts of health problems if you handle it directly, or even if you handle the urine or feces or body fluids of a person who is taking the medication. So if I were taking the medication and I sneezed into my Kleenex and then you touched my Kleenex and you had a cut on your finger, potentially you could become ill. Or if you were pregnant, your child could be damaged. Part of the protocol for dealing with cytotoxic residents is to have like a sign on your door. Same with anybody who has the flu or something, like droplet precautions, wear all your appropriate PPE, but we're not allowed to put a sign on her door even so that new staff can be fully aware because that's her home. And we can't put a sign on her home that calls attention to her medical situation. So through the OH&S committee and the Labour Management Committee, we'll come up with a number of subjects that are on the minds of the staff or even the residents or the families and bring it up in these meetings and say, this is what people are thinking, and this is what people are feeling, and this is what people are prepared to do if you don't do something soon. Or reading through legislation, which is always fun and nobody wants to do, but that's where I did find there's a clause in there that's saying that every employer must offer or must have all staff trained in musculoskeletal injury prevention. And so I was telling the boss in labor OH&S meeting, like, we need everybody to have this course because over the past 2 years, like 4 people have hurt their backs and 2 people have hurt their shoulders, even though they may have had these courses before. They're short courses. Like, it would be good for everybody to have a refresher because they're obviously not, using proper body mechanics when they're moving heavy things, or they're rushing and moving heavy things and they're getting hurt. Okay, yeah, that sounds good. That's a good idea. I'll think about it next fall. I was like, no, you better start thinking about it now because it's in legislation that it's mandatory and you have to do it. Everybody has to have it. Oh, yeah, okay. And then it comes out later that it was all his idea and everybody's going to get the training and that's super wonderful. I don't know anybody who would really just sit down and be like, oh, I was sitting down the other day reading some legislation and it just jumped out at me like, this is a thing I can use and this is going to get us some things done. This is what's going to get us the education we've been asking for 3 years. But yeah, it's a weird thing to say. I was sitting down and reading occupational health and safety legislation and then, yeah. And then I got really happy. But yeah, it's true. When you find something that works for you, it is exciting.
That's lovely. That's fabulous.